How to survive a heart attack alone. 67 life-saving tips every senior must know. What if I told you that in the 5 minutes it takes to read the script, 12 seniors will experience a heart attack, and nearly half of them will be alone when it occurs? I'm Dr. William Carson, and after 4 decades as a cardiologist, I've heard the same heartbreaking words too many times. I just didn't know what to do. The reality is that 65% of heart attack fatalities in individuals over 60 happen before they reach a hospital, often due to critical minutes lost in confusion or denial. But what if I told you that knowing just 7 specific actions could double your chances of survival? Today, I'm sharing the exact life-saving protocol that saved my patient Richard's life when he had a heart attack alone in his garden last summer. These aren't theoretical tips. They are the precise actions that could mean the difference between life and death. Life advice for older people. Welcome back to Life Advice for Older People, where we address the real challenges seniors face today. I'm Dr. William Carson, and after 40 years specializing in geriatric heart care, I've seen how proper knowledge can be the difference between life and death. Heart attacks after 60 present unique challenges. Your symptoms may differ from what you expect, and your body reacts differently to stress. The truth is that the protocol for surviving a heart attack when you're alone is significantly different from when you're with others. Today, I will guide you through the 7-step protocol I teach all my patients over 60. Why? Because when Richard, my 72-year-old patient, collapsed alone in his garden last summer, it was these exact steps that saved his life. Before we begin, understand that this information is not a substitute for emergency medical care. It's designed to keep you alive until help arrives. Many seniors live alone or spend significant time alone, and knowing exactly what to do in those critical first minutes can make all the difference. If you find this information valuable, please hit the like button and share it with someone you care about. You never know whose life you might save. If you're new here, subscribe for more life-saving advice tailored specifically for seniors. Now, let's dive into these 7 critical steps that could save your life if you experience a heart attack while alone. Tip 1. Recognize the warning signs. The first and most crucial life-saving tip is to recognize the unique warning signs of a heart attack in seniors, as they are often not what you expect. Many of us grew up with the image of a heart attack as someone clutching their chest in severe pain. But for adults over 60, especially women, the symptoms can be much more subtle. According to the latest research from the American Heart Association, nearly 40% of seniors experiencing a heart attack never feel the classic crushing chest pain. Instead, they experience what medical professionals call atypical symptoms, which are anything but atypical for seniors. Let me introduce you to Joyce, an 83-year-old patient of mine. Last year, she almost ignored the signs of a major heart attack because her only symptoms were sudden fatigue, mild dizziness, and a feeling of not quite being right. No chest pain whatsoever. Fortunately, her neighbor recognized these subtle signs and called 911 immediately. Here are the senior-specific heart attack warning signs you must know. 1. Unusual fatigue or weakness that comes on suddenly. This is profound, unexplained exhaustion that feels different. 2. Shortness of breath, especially with minimal activity or even while resting. 3. Unexpected sweating, particularly if it's cold and clammy and not related to temperature or activity. 4. Nausea, indigestion, or discomfort in the upper abdomen. Many seniors mistake a heart attack for stomach issues. 5. Lightheadedness, dizziness, or confusion. Sudden confusion can be the first and only sign of a heart attack. 6. Unexplained pain or discomfort in areas other than the chest, like the jaw, neck, back, or either arm. 7. Sleep disturbances or increasing fatigue in the days or weeks leading up to the event. Research shows that many seniors experience warning signs up to a week before a major heart attack. For women over 60, it's especially important to note that you're more likely to experience less obvious symptoms, particularly fatigue, shortness of breath, and nausea. Have you ever brushed off any of these symptoms? Let me know in the comments below. Recognizing these warning signs early and acting on them immediately is your first life-saving step. Many seniors delay seeking help because they're not experiencing the Hollywood heart attack symptoms they expect, and this delay can be fatal. Trust your instincts. If something feels wrong, especially if you have several of these symptoms together, don't wait to see if they go away. Tip 2. Call 911 immediately. The second life-saving tip might seem obvious, but it's where many seniors make a critical mistake. Call 911 immediately. Do not drive yourself. Cannot emphasize this enough. The moment you suspect you're having a heart attack, your priority is to get emergency medical services activated as quickly as possible. Every minute counts. According to the American Heart Association, for every minute that passes without treatment during a heart attack, more heart muscle dies. After just 10 minutes, damage may begin to become irreversible. And after 30 minutes, significant permanent damage occurs. Why should you not drive yourself? There are 3 critical reasons. 1. Driving diverts your energy and focus when your heart is already struggling. The stress of driving increases your heart's workload when it needs less strain, not more. 2. If your condition worsens while driving, which can happen suddenly, you become a danger not only to yourself but to everyone else on the road. 3. When you call 911, treatment begins the moment emergency responders arrive. Modern ambulances are essentially mobile emergency rooms. Paramedics can administer life-saving medications, perform CPR if needed, and use defibrillators. They also alert the hospital so a cardiac team is ready when you arrive. My patient Anthony, a fiercely independent 76-year-old, initially ignored this advice when he felt chest discomfort and shortness of breath last year. He decided to drive himself to the hospital, but halfway there, he lost consciousness and crashed his car. Thankfully, another driver called 911, but this added precious minutes of delay and caused additional injuries. Anthony later told me, "Doc, that was the most foolish decision of my life." If you're alone when symptoms start, here's exactly what to do. 1. Stop whatever you're doing and sit or lie down in a comfortable position. 2. Call 911 immediately. Even if you're not certain it's a heart attack, let the medical professionals make that determination. When speaking with a dispatcher, say clearly, "I'm a senior experiencing possible heart attack symptoms." This helps them prioritize your call. 3. Unlock your front door if you're able to, ensuring emergency responders can enter even if you become unconscious. 4. If you have a medical alert device, use it in addition to calling 911. These devices often connect you to operators who can stay on the line until help arrives. What about calling a friend or family member instead of 911? While it might be tempting to call a loved one first, this creates a delay. Call 911 first, then call family or neighbors if you're able. Have you thought about what you would do if you experienced heart attack symptoms while alone? Share your thoughts in the comments. Remember, calling for professional help immediately isn't a sign of weakness or overreaction. It's the smart, decisive action that could save your life. Tip 3. Take aspirin. The third life-saving tip focuses on a simple medication likely already in your home. Aspirin. How and when you take it makes all the difference. Aspirin is one of the most effective immediate treatments during a heart attack, but many seniors don't know the correct way to use it in an emergency. Why is aspirin so important? During most heart attacks, a blood clot forms in a coronary artery, blocking blood flow to part of your heart muscle. Aspirin works by preventing platelets in your blood from sticking together, which can help stop the clot from growing larger. Research published in the Journal of the American College of Cardiology shows that taking aspirin during a heart attack reduces mortality by up to 23%, but only if taken correctly. My patient Sylvia, aged 68, remembered to take aspirin when she experienced heart attack symptoms, but she made 2 critical mistakes. She took it with a full glass of water, which delayed absorption, and she swallowed a regular aspirin whole, which also slowed the effect. When we reviewed what happened later, she was shocked to learn the correct method. Here's how to take aspirin correctly during a suspected heart attack. 1. After calling 911, immediately take 325 milligrams of aspirin, typically 1 full-strength adult aspirin or 481 milligrams baby aspirins. 2. Don't swallow it whole. Instead, chew the aspirin thoroughly before swallowing. This allows the medication to enter your bloodstream much faster. in about 5 minutes versus 30 minutes when swallowed whole. 3. Take the aspirin with just a tiny sip of water, only enough to help you swallow. 4. Tell the 911 dispatcher and paramedics that you've taken aspirin, including the exact amount and time. Important cautions. If you have an aspirin allergy, a history of bleeding disorders, are taking blood thinners, or have been specifically advised by your doctor not to take aspirin, skip this step. Also, only use actual aspirin, not acetaminophen, Tylenol, ibuprofen, Advil, or other pain relievers, as these don't have the same blood-thinning effects. I recommend all my patients over 60 keep aspirin easily accessible in multiple locations: your purse or wallet, bedside table, kitchen, and car. In an emergency, you don't want to be searching through cabinets. Did you know about this chewing technique for aspirin during a heart attack? Let me know in the comments if this was new information for you. Remember, aspirin is not a substitute for emergency medical care. It's a supplementary measure while waiting for paramedics to arrive. The combination of prompt 911 calling and proper aspirin administration has saved countless lives. And it could save yours too. Tip 1. Position yourself for survival. The fourth life-saving tip might surprise you, as it contradicts what many people assume. Position yourself correctly while waiting for help. Contrary to popular belief, lying flat isn't always best. How you position your body during a heart attack can significantly affect how hard your heart has to work and how much oxygen it receives. For seniors, this can be particularly important, as our cardiovascular systems are already under great strain. Let me share what happened with my patient Carlos, age 77. When he experienced heart attack symptoms while alone, he remembered seeing a movie where someone having a heart attack was laid flat on the floor. He did the same, but this actually increased his difficulty breathing and put additional strain on his heart. When paramedics arrived, they immediately adjusted his position. So, what is the correct position? The answer depends on your specific symptoms. If you're experiencing shortness of breath, which is common in seniors during a heart attack, the ideal position is what medical professionals call high Fowler's position, sitting upright with your back well supported and knees either bent or straight. This position allows your lungs to expand more fully, reducing the workload on your heart and improving oxygen flow. If you're feeling lightheaded or dizzy, a slightly reclined position is better, sitting at approximately 45 degrees angle with your back and head supported. This helps maintain blood flow to your brain while not putting extra pressure on your heart. If you're experiencing nausea, another common heart attack symptom in seniors, sit upright and turn slightly to your left side. This position can help prevent aspiration if vomiting occurs. The key for all positions is to avoid unnecessary strain. Don't stand or walk around while waiting for emergency services. And ensure you're in a stable position where you won't fall if you become dizzy or lose consciousness. What about loosening tight clothing? This common advice is actually correct. Particularly loosen anything tight around your neck, chest, or waist to make breathing easier and reduce restriction on blood flow. Another important consideration is temperature. Heart attacks often cause cold sweats, and seniors are particularly vulnerable to temperature changes. If possible, cover yourself with a blanket if you feel cold, as shivering increases your heart's workload. Where should you position yourself in your home? Ideally, choose a location close to your unlocked front door where emergency responders can easily find you. If you live in a multi-level home and experience symptoms while upstairs, do not attempt to go downstairs. The exertion could worsen your condition. Instead, call 911 and tell them exactly where you are in the home. Have you thought about where in your home would be the best place to wait for emergency services? Share your thoughts in the comments below. Remember, these positioning strategies are temporary measures while waiting for professional help to arrive. They're designed to reduce strain on your heart during those critical waiting minutes, but they don't replace proper medical treatment. Tip 5. Control your breathing. The fifth life-saving tip addresses something that happens automatically but needs conscious control during a crisis. Control your breathing using the 4-7-8 technique to reduce heart strain and anxiety. When you're experiencing a heart attack, panic is a natural response. Your body floods with adrenaline, your heart rate increases, and your breathing becomes rapid and shallow. For seniors, This stress response can significantly worsen the heart's condition and reduce oxygen flow, precisely when your heart muscle needs it most. My patient Vivian, age 71, credits controlled breathing with helping her survive until paramedics arrived. When I felt the pressure in my chest, she told me, "My first instinct was to panic, but I remembered the breathing technique you taught me. Focusing on my breath not only calmed me down, but gave me something constructive to do while waiting for help." The 478 breathing technique, developed by Dr. Andrew Weil and supported by research in cardiovascular medicine, is simple but powerful. Here's how to perform it during a suspected heart attack. 1. Sit in a comfortable, supported position as discussed in our previous tip. 2. Place the tip of your tongue against the ridge behind your upper front teeth and keep it there throughout the exercise. 3. Exhale completely through your mouth, making a gentle whooshing sound. 4. Close your mouth and inhale quietly through your nose to a mental count of 4. 5. Hold your breath for a count of 7. This might be difficult if you're experiencing shortness of breath. If so, hold for as long as is comfortable, even if it's just for a count of 2 or 3. 6. Finally, exhale completely through your mouth to a count of 8, making that same whooshing sound. Repeat this cycle at least 4 times or continue until emergency services arrive. Why does this technique work? The extended exhale activates your parasympathetic nervous system, often called the rest and digest system, which counteracts the panic response. For seniors experiencing a heart attack, this can reduce heart rate, lower blood pressure slightly, and increase oxygen efficiency, all beneficial during a cardiac event. Research published in the Journal of Emergency Medicine shows that controlled breathing techniques can reduce pain perception by up to 28% during acute cardiac events. Even more importantly, reduced anxiety means less adrenaline surging through your system, which decreases the workload on your already stressed heart. Another benefit, particularly relevant for seniors, is that focusing on your breathing provides a sense of control during a frightening situation, which can help you make better decisions and communicate more clearly with emergency responders when they arrive. Have you ever used breathing techniques during a stressful situation? Share your experience in the comments below. Remember, this breathing technique doesn't replace medical treatment, but it's a powerful complementary approach that can potentially extend your window of survival while waiting for professional help. It's also a tool you can begin using immediately without any equipment or preparation. Tip 6. Self-administer chest compressions if necessary. The 6th life-saving tip addresses an extreme situation that requires knowledge most people don't have. How to perform self-administered chest compressions if you begin to lose consciousness. I want to be absolutely clear. Traditional CPR cannot be performed on yourself. It's physically impossible to perform effective chest compressions on yourself while unconscious. However, there is a modified technique that can help in extreme situations when you're alone and feel yourself beginning to lose consciousness. This technique is controversial in medical circles, with some doctors hesitant to teach it. However, after 40 years of cardiology practice, I believe seniors should know all their options. My patient Samuel, aged 74, used this technique when he felt himself blacking out during a heart attack while alone at his cabin. He later told me, "I was sure I was going to die. Trying this gave me a fighting chance until my neighbor heard me and called 911. Here's the modified self-compression technique. 1. If you feel yourself beginning to lose consciousness while waiting for emergency services, immediately lie down on a hard surface, preferably the floor, not a bed or soft couch. 2. Make a fist with one hand and place the knuckle side of your fist in the center of your chest, directly over your breastbone, sternum. 3. Use your other hand to push your fist forcefully against your chest, then release. The motion should compress your chest about 2 inches deep. Try to maintain a rhythm of about 100 compressions per minute. That's approximately the beat of the song Stayin' Alive by the Bee Gees, which is the same rhythm taught in CPR classes. 4. Continue until help arrives or you regain more stable consciousness. Why might this work? Standard CPR works by manually pumping blood through the heart when it's not beating effectively. This modified technique can potentially provide some blood circulation if your heart goes into a dangerous rhythm. It is not as effective as proper CPR administered by someone else, but in a life or death situation when you're alone, it may help circulate blood to your brain and heart. Important cautions. This technique has risks, particularly for seniors with osteoporosis or previous rib fractures. It could potentially cause rib injury. However, in a situation where the alternative is death from cardiac arrest, most medical professionals agree that attempting this technique is reasonable. This is truly a last resort measure. Your primary focus should remain on calling 911, taking aspirin if appropriate, positioning yourself correctly, and using the breathing technique we discussed earlier. Have you ever learned CPR or other emergency techniques? Share your experience in the comments and let me know if you think more seniors should be taught emergency cardiac procedures. Remember, the ideal scenario is receiving professional medical help as quickly as possible. All these self-administered techniques are temporary bridges designed to extend your survival time until proper medical care arrives. Tip 7. Create a heart attack action plan. Our seventh and final life-saving tip may be the most important of all. Create a personalized heart attack action plan before you ever need it. The reality is that during a heart attack, your thinking becomes clouded. Pain, fear, and even the physiological effects of reduced blood flow to your brain can impair your decision-making abilities. For seniors, this cognitive impact can be even more pronounced. My patient Louise, age 79, credits her advanced planning with saving her life. She had created a detailed action plan and reviewed it regularly. When she experienced heart attack symptoms while alone, she didn't have to think. She simply followed her